So far, there have been no local transmission cases occurring in the United States or places outside of China. So there are almost 100 travelers in the U.S. that are being monitored because they had been in Wuhan, but there is not local transmission yet. So that monitoring of people who might have been exposed a week or two ago when they were in China is part of the United States' attempt to catch this early if we start seeing cases happen. So if any one of those returned travelers test positive at some point in the next week or so, all of their contacts will be screened and monitored as well. So the hope is that that's going to keep things from becoming a wider outbreak here in the U.S.
You study this stuff all the time. What catches you by surprise in this? I mean, just from a reporting standpoint, it just seemed like drip, drip, drip initially from Wuhan, a case here, a case there, mysterious pneumonia, and then all of a sudden it just seems like an explosion. Is that normal?
It is normal, but I will say I've been a bit surprised at how quickly the total case count has gone up. And the reason that's going up is in part because Chinese public health officials are being so aggressive about trying to find cases, which is exactly what should be done at this stage. The number that I'm looking for is the death count, which right now is still less than 100, and we haven't seen that go up at the same rate that we've seen the case count go up. So if we are still mostly seeing deaths among older people who had underlying health conditions, that's not as concerning as it would be if we started seeing more deaths and also deaths in younger or healthier people. So that's what we'll be looking at, but it's really early, and this early, we're only about a month since it started. There's just a lot that we don't know, and so we still need to understand how contagious is this? How exactly is it transmitted? What is the incubation period? Is it 7 or 10 days? Could it be shorter or longer? We'll be learning more about that in the coming weeks, but right now, just every bit of information that we get helps us understand this more.
And having tracked these things, studied these things, how long are we looking at? I mean, best case scenario, worst case scenario?
So all the people who are going to be diagnosed this week already contracted the virus before the travel restrictions went into effect. We're not going to see the number of new cases per day going down for a while yet because we only had the travel restrictions start about 5 days ago. It's going to be at least a few more weeks before we know if this is starting to level off or if we're starting to see it expand. Some of our information will come by looking at travelers in other countries and seeing if local transmission happens anywhere else. But it's going to be at least several weeks before we have a sense of how explosive this could be or how well it could be contained within a few weeks.
What did we learn from SARS that may be transferable to this particular situation?
I think everything we're seeing about the response in China is a lesson from SARS. We're seeing that aggressive isolation of patients. We're seeing people being told, go get tested if you think you might be infected, so that we know what the situation is. Being told, stay home if you're feeling sick. Don't congregate, no matter how healthy you are, with other people. Let's try to slow down the transmission chain. All of those are lessons from SARS. China is better prepared than any other country would be for this kind of response because they've seen a coronavirus infection like this before.
What about the animal? Is it important that we know that? Is that less important? And then also the possibility of a vaccine.
So the animal at this point, it doesn't really matter where this started. A year from now, it'll be nice if scientists have figured that out because that may prevent the next outbreak. But for this outbreak, what we care about now is person-to-person transmission. And it's going to be at least several months, probably more like a year, before we have a vaccine that's created, tested, manufactured, and distributed. So public health measures are what we have to focus on now.
And if the vaccine comes a year from now, hopefully we won't need it at that point. Maybe
That's the hope. The hope is that this will be well under control before then. But again, it's early in the epidemic. We're just going to have to be patient and see how the data show up in the coming weeks.
Kathryn, always a pleasure.